really love for you to get into shape before I introduce you to our presenter, Dr. Samantha Reeves. So if you are already in the SHAPE system, if you're an active member, please take this time while others are joining the session to log in. And if you're not yet an active member or registered in SHAPE, please take this time to sign up for your free membership. And then you can get acquainted with the system under the guidance of Sam during this session. So hopefully you're all doing that now, and I'll make my introduction. Again, thanks everybody for joining us, and thanks for logging in or registering with the SHAPE system. And I need the next slide, please. In this session, we are all going to get in shape to help us assess and plan for comprehensive, trauma-informed, safe, and supportive schools. If this isn't the presentation you intended to join, please go back to the Summit website under the Agenda tab and click on Join Here button next to the option you wanted. I have put the link, or Hannah will put the link into the agenda page in the chat just for your reference, but we really hope you all stick around for this great session. As a friendly reminder, please remember to select everyone when you use the chat function so everyone can see your message. Later, we hope to have a little time for Q&A, so you can please submit questions using the Q&A button or in the chat, and we'll be monitoring those. And closed captioning is available by clicking the Show Subtitle button on the bottom after you click on closed captioning. Now, without further delay, I am so honored to introduce you to our presenter, Dr. Samantha Reeves from the National Center for School Mental Health at the University of Maryland. Dr. Reeves' research interests lie at the intersection of mental health and education, and she often investigates how school or family factors influence student outcomes in underserved communities. She's going to walk us through this free web-based tool to help you see what kind of shape your trauma-informed care at your school or district is in. Dr. Reeves, we are so happy to have you with us and to learn more about the SHAPE system. So please take it away.
I'm so excited to be here. Thank you, Michelle. And we're going to have to recruit you to help us come up with slogans. You gave us some great ones for getting into SHAPE. So over the next hour, we are going to spend some time just getting to know the SHAPE system and the resources that are available there to help you with your action planning around school mental health in general, and more specifically around trauma, if that's where you're ready to have your deep dive. As Michelle said, I am from the National Center for School Mental Health. It's been around since the 90s, feels like forever ago now, and it's with funding from the Health Resources and Service Administration. We are working to strengthen policies and programs around school mental health, and we do that through research, through evaluation, and through technical assistance. And one of the great resources that has came out of the center is the SHAPE system. And it houses our national performance standards and our national census data around how school mental health is working across the country. Next slide. So for our first little discussion, I want you to think about what you are really hoping for. If you could sum up trauma-informed schools in one word, what would it be? What is the priority for your school or district when it comes to addressing trauma? And you can just pop them into the chat box and I'll read a few of them out loud. But I'm just trying to get a feel for where people are at. What is the priorities that you're focusing on right now? And while people are popping things down there, I will go over some of the parallels between trauma-informed practices and comprehensive school mental health. So they're both these kind of system-level tiered approaches towards serving students, toward ensuring that kids have access to the resources and supports that they need. They are typically a tiered approach where we have services available for everyone, usually our tier 1, our mental health promotion activities. Yes, thinking about things that are more comprehensive and helping kids be successful in the classrooms. And also the support things that happen behind the scenes. So adequate training, ensuring that providers and staff are being culturally responsive, and forming partnerships across our families and our communities so that we can have these robust systems that are supporting kids in lots of different ways. thank you all for putting your priorities in the chat box. Yeah, making sure we're not punishing kids who are traumatized, developing coping skills, particularly around the pandemic, where a lot of us are feeling, I think, a little more stressed than we might have been beforehand, and a focus on staff well-being. And the nice thing about the resources we're going to talk about is that they can be helpful for those goals. We can take a more targeted approach and dig down into our trauma-informed resources, or if you're feeling like you are in need of resources for things that are a little more broader, we have resources for that as well on SHAPE. So what's going to pop up next is a little poll to see where you are for your comprehensive school mental health system. So thinking about where you are in general, if you were to rate how where you're feeling in terms of comfort, are you just starting out when it comes to figuring out what's going on for your school mental health system, or do you feel pretty solid, like you have a plan, you know what's working well, the things that aren't working well, you know how you're going to address them, and just to give an idea of where we are at as a group. And I'll be quiet for like 30 seconds so you have time. All right, we'll give everyone a few more seconds to enter in their poll. And then Hannah, when you're feeling like enough has come in, we can close it and show the results. Okay, so we have people who are feeling, looks like, in the middle a lot, feeling pretty solid, like things are, they've got a plan, and some people are just starting out. So that's helpful to know. So the next poll that's going to pop up is asking about your trauma-informed practices in particular. So where you are as far as just starting out, or do you feel like we're cooking? We've got a plan around trauma that feels like we've got the training in place, our staff are using the trainings that we've gotten from our trauma-informed practices, and our kids are responding pretty well to that, to what we have available. And again, I will sit quietly, wishing I could talk to you while I let you do your poll options. All right, I'll give you a few more seconds and then we will close our poll and see where we're at. Awesome. So similarly, we have our group is feeling somewhere in the middle, feeling pretty, looks like pretty confident that we've moved away from just starting and we are in the midst of implementing our trauma-informed practices. Thank you so much for participating in the little poll, and it just helps give me an idea of where everybody is at in our little group today. So I can make sure I gear things towards your interest. Okay, next slide. So what we're going to focus our attention on today is the SHAPE system. And as Michelle mentioned, it is a web-based platform. It is free, and it houses several useful resources for assessing and improving your comprehensive school mental health system. The School Mental Health Quality Assessment is our measure that allows you to rate your school as it aligns with best practices. So this one will help you see where the best practices are around school mental health, and then you can indicate whether or not you never do these things or always do these things. So it can be a working document. So you can complete it as a baseline with your team, and then updated periodically throughout the year, so it can be like a working action planning document. The school mental health profile is more like an inventory. So this is a good place to start if you want to catalog what kind of services and supports you have available for your schools and your students, and if you want to review what kind of staffing you have available. So it really gives a nice summary of where you are at now, what you have available in terms of school mental health services and support. The screening and assessment library can be used in addition to a lot of these assessments to give you resources and ideas for how to improve your school mental health system. And there are able to be, you can search through them by the different domains that are going to be covered, and resources for improving that. The last assessment that's available on the SHAPE system is the Trauma Responsive Schools Implementation Assessment. So this would be useful if you are ready to kind of deep dive into your implementation of trauma and responsive care. And that's a nice place to start if you were there. Okay, so on our next slide, for those of you who are already in SHAPE, you can get started on your little scavenger hunt. So what we're going to do is rummage around the system a little bit, try to find things, get oriented, feel like feel comfortable navigating the system. So there's a few things that you can do, and we're going to try to complete our TRS, and then I am going to also share my screen so I can sign up and get into the system so that you can see what it looks like, even if you are having some trouble on your end getting in. And you can always email me after if you need extra assistance getting into the system. Okay. Okay, so this is what our homepage looks like on the SHAPE system. And there's a little sign up button up here in the right-hand corner. And it's going to take you through a series of questions to help you get registered into SHAPE. And you have some options. So you can fill it out with your contact information and your email, and provide your role or position. And then you have some options down here. So the individual account will allow you to access the SHAPE system and the resources, let you see some of the measures that are available, but it won't tie your information to a particular school or district or state. So these other options let you either join a school account that's maybe already open or start one for your school, which is probably where most people will be at. So you can choose whether or not you are most familiar with a school. So if you're thinking about your child's school or the school you work at, that would be a place to start. If you work at a district or state level, then you might want to pick some of these other boxes. But I'll go into the school, and you can select the state you're from. And they'll ask you these questions even if you are choosing individual. And then you can pick a district. Oh, it won't let me click on the right one. And then there's be a box for if you're employed by the school. So if you're employed by the school and you work closely with them, you can check that box, and this allows you to create an account for your school. And then it's going to ask you some questions in general, about what is happening at your school or district. And you can click not sure if you don't know, but they will ask about whether or not there's universal mental health screening. Do you use evidence-based practices? So it just is asking for some general information about the school or district that you said you're most familiar with. So then it's let me sign up. it tells me it's complete. And then the next page is going to ask you for a password, I believe, if I've memorized this correctly. Oh no, just lets me on. So we are now inside the shape system. We have gotten into shape. And at the top of there are several different tabs available to help organize and orient you to what is available in the system. The first tab, like I said, is the school mental health profile. And this one lets you catalog and describe your services and supports available. All of the measures are available in a printable version, so you can click on those if you want to complete them hard copy in a meeting. But also the nice thing about Shape is that your team can complete them individually right online, and then the system will generate a report for you that comes up with an average. So if you want to print them out and do them together at a meeting and technology is not your friend in your building, then you can do it that way, or you can assign it where everyone can join your team for the school and complete them right online, and then you can get a summary report available. And also, if you're the team administrator, you can download the data here as well. So that's one option, and it has 3 domains that it's looking for. So the staff that are available, who is on your school mental health team, the services and supports, what kind of services do you have available for the students at your school? Do you have trauma services? Do you have supports for kids with behavioral problems? Do you have supports for kids with anxiety? So it goes through those different mental health areas and asks whether or not you have services available. And then it asks some questions around how you use and manage your data to inform your school mental health system. So those are the 3 big areas there. And there's instructions here, there's a printable version, and it comes with a sample report. The next thing available is the school mental health quality assessment. And this helps teams assess how they align with best practices in 7 areas. Teaming, so that's going over the structure and process and content of what it means to have a school mental health team, who's on it, and what does that team do. Needs assessment and resource mapping, that covers how you're assessing and using, assessing student strengths and needs, and using that data to inform your services and supports. Screening is universal screening. So figuring out a way to screen kids at the population level of your building as a way to make sure we're not missing any kids in between that might get funneled out by other ways of screening or referral down the line. Then there's mental health promotion, which is our tier 1, and usually around like SEL, teacher well-being, positive behavior support management, and those kinds of interventions are there. Early intervention and treatment supports and services, those are our tier 2 and our tier 3. So what do we have available at our tier 2 level? Our small groups, our at-risk youth in that area. And then these last 2 are, again, around how is our school mental health system being funded, and what is the impact of it? So being able to collect some data around how the services and supports we have available are impacting our students, and keeping an eye on how we're funding them and how we are making this sustainable for the future. So again, there's an option to complete this right online. You can take the survey and fill out all of the domains, and it will create a summary report. There's a printable version. There's also a sample report here that can tell you where you're, if you want to show it to someone else. And it will rate you, and it will give you a score that lands in one of these 3 buckets. Mastery, those are going to be our 5s and 6s, where you're feeling pretty solid. Progressing is we're getting close. We've got some best practices in place, but some things that we're not doing often or all of the time. And emerging is when we are starting out and we're using some best practices, but maybe a little more infrequently than we would be in those other 2 groups. And then it gives an option down at the bottom for how many of the kids, what percentage of kids have been screened at our school. And then it provides some overall data for you, the averages per each of the items based on who entered data. And then there's some resources at the end for action planning. So that is the school mental health quality assessment. And then we have our resources and our screening library. Both of them will help you with your quality improvement efforts. And the left-hand side here has resources and filters so that you can pare down into what you need. So if you decided that what you want to work on is trauma-informed care at Tier 1, then you can click down here, and this will give you all of the resources we have available for helping to improve our Tier 1 services. So you might find something there that might be helpful. The other resource is the screening and assessment library. So say you decided you want to implement a trauma screener, then you could come into our screening and resource library, click the trauma box. You want to use it for screening in eval, and we're looking at middle school age. So it'll give you the screeners that we have available on this system that might fit that need. So then you could go here and see whether or not you want to try the Spence Child Anxiety Scale or the Trauma Event Screening Scale. So it has some resources here for you to pick some measures that you might want to implement in your school. The final thing on here is the trauma responsive school implementation assessment. And this was developed in partnership with, and I always mess up this acronym, NCTSN, Treatment and Service Adaptation Center for Resilience, Hope, and Wellness, in partnership with the National Center for School Mental Health. And much like the other measures on here, it's modular. You can do it domain by domain. There's a printable version available. It offers a summary report. And this one is really focused on trauma-informed implementation. So this would be a place to start if you were ready to like deep dive into your into how your trauma-informed practices are going. And it will go through whole school planning, and you would rate yourself from very comprehensive, from minimally comprehensive to very comprehensive, or clear to define to not. And this is the implementation of trauma-informed practices. So that is available there as well. So in addition to all the resources, you have a school account. And this is where you can manage who's on your team, who you want to invite, who you think is important to include here. So if I wanted to add Michelle to my team, I could go here, I could put in her email, her first and last name, and then it would send an invite to Michelle to join my team here on Shape. So if you have somebody in mind who you would like to be on your school team, you can practice doing that now and sending an invite here. And this will allow them to come onto Shape to enter in their data, and that way you can get your report right online, and you don't have to do all of the averaging of everybody's responses or the data entry point. They can do it, and then the system will give out a report for you.
Sam, I wonder if we could take a short pause right now because we have a couple of burning questions from the audience. Do you have a second?
Sure.
Yes. One question just on general overview of the account settings and orientation. If you were to set up your account as an individual account and then want to switch it to a school level account later, can you do that?
So what will happen is once you're in your individual account, there'll be a box on this page that says like join a team. So then you can request to join a school team. And then it just has to be approved by the person who is the holder of that account. They have to say, like, yes, Michelle can join my school team. But yes, you can move to a school account.
And if you wanted to be the administrator of the school account, you would just sign up again, but under a school level?
Mm-hmm. Yeah, if you work at a school, and I would just sign up for the school account, there's a box here, so where you can allow your data to be shared or accessed. So if you're worried about whether or not your data is going to be looked at, then you can just uncheck this box. But if you work for a school and you are interested in having access to the school level information, then I would just sign up there. And if you're worried about your data in some way, then you can just uncheck the box. But the other way is to go in as individual and get invited in.
Okay, great. And one other question, if you're just starting out with the SHAPE system, you mentioned a bunch of specific surveys, the school mental health profile, the mental health quality, and the trauma responsiveness surveys. Do you have suggestions about which one you would start with, or would you suggest that you do all of them?
So if you are just starting out or planning, the school mental health profile is always a nice place to start because it allows you, it's information that you probably have access to. And it just lets you check in whether or not you have certain things. So this might be a good place to start for new users because they can just go through and decide whether or not you have supports in Tier 2 or evidence-based training. So that might be a good place to start. And then how you're using data. And then based on this, you might decide, okay, what I really want to do is look at how we're doing against best practices. Then you can come to the school mental health quality assessment. If you're ready to deep dive and you're feeling pretty confident in general about how your system is functioning, then the trauma responsive assessment might be a good place to start. If you're particularly if you're looking at your trauma implementation.
Great, thank you so much. Those are the ones that I saw so far. So, and I know it's hard to see the chat when you're sharing your screen. So,
yes.
so thank you.
Thank
Sam.
you. Okay. Okay. So to just take you through the things that I put on our little TRS. So you could come here, and this is where you would download a TRS version. And if you were to locate a trauma screener, then you would go to your screening and assessment library. We would click on trauma. We would click on screening and eval, and then I'm gonna just pick a middle schooler. Is that a middle schooler? And then this would be how you could download information about this particular screener. And it tells you what the focus area is, gives you some sample items to help you make your choices, and some links to the actual measure. The other thing that can be really helpful is, the quality guides. So for each of the 7 domains of the school mental health quality assessment, there is a companion quality guide, which can help you when you are stuck or need some inspiration or explanation. These are good places to start. They give pretty comprehensive overviews of what it means as a domain. So, and they're for each of them. And then resources and spotlights from the field on other things people have done and tips and tricks. So these are also good resources too. If you are needing help paring down or worried about where to start, the quality guides are nice resources. And like I said, you can go to your team page and add people if you want, if you are feeling like you want to have somebody join you on your SHAPE team. And then if you're a school admin, there are some buttons here that help you manage your team. So you can promote people to an admin on your team. You can demote them, I guess, down to a team member. And then this is the permission slide about where and how your data gets shared and used here. And if you were to go on our scavenger hunt, and the last one was to answer the first question on the teaming domain, that is in our mental health quality assessment. And our teaming domain is our first one. So you would click your survey, and then each of the individual questions pops up as one of its own, in theory, with some introduction about what each domain is. So this tells you a little bit about what we mean as far as teaming goes. And then you just click through. So what extent does your school use best practices to ensure your school mental health team is multidisciplinary? So we have the rating scale up top, and then they have the best practices on the bottom. So we included the best practices so people would know what we mean about that instead of just saying best practices. So they're always right underneath the question, and you can just say how often you do that. And it will take you to those items through teaming. And then once you're done, you can move on to your other domains. And as you move on, your house will fill up. And when it's all filled up, it will all turn bright yellow. Okay. All right. That's a little bit about the shape system. Are there any more burning questions that came through? Michelle?
I think we're good for now. We had some questions about using the online tools and understanding that if you conduct the surveys online, then the data are tabulated online for you. But if you do use the paper forms, that's something you would have to do on your own, right? Okay.
Yes.
Good. And I answered it right for you.
Yeah.
Okay.
So if you decided to go into your meeting and fill this out all together and come up with some kind of composite, you just came up with an agreement for your rating on each of these things, then Michelle could go back in and just enter the data if she wanted to, and then still get a summary report. The thing you lose on that is that everybody's individual scores aren't available. It would just show up as Michelle's data, even though it was a group effort. That would be the only difference.
Great. I think those are all the questions so far now. Thank you, Sam.
Okay. And then for districts and state leaders, there are some additional features on your boards, on your dashboards that allow you to look at the data from the schools in your district or from the schools and districts in your state. So there's some added features there to help you look at the quality of school mental health in your district or state. And then there's some additional functions that allow you to download the CSV file for information where people have shared their data and completed it in your school. So in this Take district, these 4 schools have completed it, and had they entered data, I would be able to click on it and view it, and also download the CSV file so that if you need to manipulate it for your own purposes, you have access to the CSV file as well. But that's the difference between the 2 little dashboards. So there's some other additional functionalities for district and state folks for managing data and being able to look across the whole district or the whole state. Awesome. Okay. All right. So the next thing we're going to talk about is we're going to use Jamboard to have some more discussion about what improvements you would like to see in your school mental health, state, district, or school. What are the areas, and I know we chatted about this a little earlier, so you might steal some of the things you already put in there. But what would you hope to see improve in your school or district? And then the second question that kind of goes along with the first one is what changes? What do you think needs to change for those improvements to happen? So if you want more staff training, what do you need? Do you need a group facilitator? Do you need more support from your district? If you want to see greater focus on teacher well-being, then maybe you need to assess staff needs. But just try to think about what you hope to see and what kind of changes you think would have to happen for it to be successful. Universal screening that is meaningful and we can act on. That's a great one. Mhm. Better identification of students with internalizing disorders. Screening. Being able to identify kids that are suffering from racial trauma. We'll keep popping them up there, and I will keep an eye on them. So what we're going to talk about in this next little bit is how we can get to these improvements that we see. How can we get to a place where we have better screeners, where we can we can identify kids who are suffering from racial trauma, understanding better the data that we have around discipline and how that relates to trauma. So we're going to talk about how we can get from the things that we wish were happening, that we want to see more of, and how we can change to get there. So the Institute for Healthcare Improvement, they have the Plan, Do, Study, Act cycle. This is what we use when we are supporting state leaders in our school mental health coin, our collaborative, oh my gosh, I always forget the Collaborative Improvement and Innovation Network, to support them around making change and action planning around school mental health. And the purpose of this cycle is small tests of change, small, rapid tests of change, things that you can do in your day-to-day to move towards those improvements. So if understanding kids, identifying the kids that are suffering from racial trauma is the goal, what is some change in our day-to-day that we can do to get us closer to that goal in tiny, small pieces? We can go to the next slide. I think you can click through the, yep. Oh, no, back one. So when we're talking about change, we're talking about these small tests of change and these little change ideas. And the hope is that we connect our improvements to our changes. So not only are we thinking about what we want to change, but we're thinking about how we can do that. And common types of change are to manage time differently, to improve something that is already going on, to change something in the environment, to create efficient workflow. So we're talking about really real changes that are happening in our day-to-day that help us lead to those big improvements that we're hoping to see, those big changes in screening processes. Okay. We can go for it, and we can skip this one. So the important thing to think about here is to dream big and think really, really small, and to start small. Think of something that is accomplishable, that you have motivation around, that you have some momentum and resources for. So if you go through and you complete your school mental health quality assessment and you circle all ones in teaming, you're never doing any of those things, then maybe that isn't the best place for you to start because maybe the resources aren't there, or maybe it's difficult to form teaming based on where you are in the country or how far you are away from other providers. But you do have some momentum around your tier 1 services. So maybe you start there and you think about what you can make changes around that is already going on, that you feel good about, that you have some momentum around, so you can get some early wins and some small successes, and then leverage that to help you in those more difficult areas. You might come back to teaming later. Okay. So when we think about what changes could lead to our improvements, you can also steal shamelessly, as we say, right from the school mental health quality assessment around what the best practices are to help you form what you're going to do in your action planning. So this team, their goal, their improvement was they wanted to have to continue having efficient and effective school community partnerships during distant learning. and the changes that they were going to do in their day-to-day system to get to that were to adapt communication mechanisms for remote learning. Some ideas were to adjust data sharing agreements for e-sharing, to revise your memorandums of understanding to reflect current school practices. So there are several different ways and several chunks of this that teams could go down to get to the same improvement. So it's just a decision on where you want to start and what changes you want to make. So the nice thing about the school mental health quality assessment is because the best practices are listed right in the measure, you can refer to it and you can use it to help you decide where you want to make your improvements and what you want to tackle. So as you can see from that last page, we pulled right from the school mental health quality assessment. So these are the best practices from facilitating effective partnerships with community partners. We pulled it right off of the school mental health quality assessment to help us come up with our ideas for how we're going to plan. So see the second bullet, use memorandums of understanding and other agreements to detail terms of partnership. So that was one of the ways that we could adapt what we were doing to improve our goals around effective partnerships. So use what you have available to help you make your plans. Next slide. And the hope with the PDSA cycle is that you have these multiple steps. So you can develop an idea, you can test it, you can see what happens, but it's on such a small scale that it allows you to make changes. Or if something doesn't work, then you can go back and change it, but it didn't impact your whole. You didn't send out a screener to all 300 kids, you sent it out to 2 kids and found that, some of the questions didn't work or kids didn't feel comfortable with them. So you can change things at a small level before it gets out to the big one. So you have enough time to refine it, to look it over, to try it a different way, to see if it's going to work. Can you scale it up? And eventually, after you do a couple of these small tests of change that are building on each other, and you're implementing this change, then you can have this more system-wide school or district level change that has resulted from all of the hard work you've done before in these small little pieces, if that makes sense. So for PDSAs, we are going to focus on things that can be completed in less than 2 weeks. So that's the length of time you're looking for from the question I just saw in the chat box. So you're thinking really small, really minute of what you can change in the next 2 weeks or tomorrow, right? What is something that you can change in your day-to-day practices in the upcoming weeks that is accomplishable? So that's how small we're talking. And if your test fails, that's fine. It's still good information. So if you gave that screener out, the trauma screener out to the kid, and they gave you feedback that a couple of the questions were offensive, then you know that that's not a good screener. But you also didn't give it to 300 kids, right? You gave it to 1 kid. You can revise it. You can change what you're doing, and it allows you to come up with a different test of change. So you might, in your next one, use a different screener from the library or another one and see how that worked with kids and see if they prefer that one better. So it allows you to build on the information that you got, the data that you received. And if it works, great, then you can stack them as these 2 try. So for test 2, try 2 new family meetings with different scheduling processes for each family. Oh, that works, great. So you should try the successful process with 5 families, and you just keep trying to scale it up further and further. But if it didn't work, then you just go back to your drawing board and try to figure out what the barrier was, and then you can make your test of change around that. And oftentimes you might find that you're a little out ahead, and that, like this one, they wanted to have these feedback sessions, but they figured out that they had a scheduling issue. They had to remedy the scheduling issue before they could get to this other one. So if it fails, that's fine. It's information that can help you in your next test. And it's part of the process. Lots of times these things are linear, and that's one of the benefits of starting small. So on our next slide, there are reminders for why we do this in small changes. It allows you to focus on something. It allows you to evaluate the costs and side effects of change. It can minimize resistance to implementation. Instead of changing something drastically, really quickly, we're changing something slowly and with lots of feedback as we're scaling it up. So this helps us be ready for some more, feel more confident in the changes that we're making. And the next slide is also a good reminder that it keeps us out of our disaster zone. If you can click on it again, yeah. It keeps us out of our disaster zone where we might be there might be really high consequences for if this doesn't work out and the test is really large. So if you give out a screener and you didn't talk to parents first and it gave it to everybody and now everyone's mad at you and it's all the way out here, then it causes more disruption than if we did it small, got some feedback, and we figured out a long time ago that parents weren't going to be amenable to it. So it lets us keep things small. It lets us keep things out of our disaster zone where things may be really, really big and the consequences may be more steep. Okay, for our final bit, we're gonna give it a try. So there is some fake data that I put together on the first, this is from the TRS, the Trauma Responsive Implementation Assessment. And this is our whole school trauma programming. And it gives us some information on how training is going at this school. And it lets us know, it looks like they have some trainings in place. They have some policies in place. Whether or not they're used consistently seems to be up in the air. And for lots of the training, they seem to be minimal. They have these 1 hour in services at this place. And on the next page, this team also completed our school mental health quality assessment, which again allows people to rate themselves on their best practices and for how well they are aligned with best practices for supporting teachers. We've got a sometimes, right? Sometimes we're doing interactive training. Sometimes we've got ongoing support, which we kind of saw on that last page. Sometimes those things are happening. But they're pretty minimal fidelity monitoring, like making sure that they are following up, that teachers and staff are using the information implemented at the training. So based on these two data points, we're going to try to come up with little tiny tests of change. So on the next slide, they show some different ways that you can measure or implement a test of change. So we've got our overall improvement that we want, our continued, efficient, effective school and community partnerships. That's where we're hoping our changes lead towards. And they've decided that they're going to adapt communication mechanisms for remote working. Again, still really big, right? You could do that a number of different ways. So this team gave 3 potential ways they could go about improving that in their day-to-day. They could possibly test virtual huddles on Zoom. They could have a private school mental health discussion space on Google Classroom. They can implement a school mental health team email thread. So even when you get to your best practice that you want to focus on, you can still get smaller and think about things that you can do within 2 weeks, get some data on, be able to kind of reflect on it and come up with your new idea. So you want to think really small, like starting a team email thread is something somebody could do tomorrow. Opening up a Google Classroom thing, if you have Google Classroom, can be done within the week. So that's what we're thinking about here. And there are some reflection questions that are on the next slide to help you kind of come up with your test of change. Think about what you could do tomorrow. And if that doesn't work, what could be done next? But that's how small we're trying to keep it. So back on your Jamboard, we only have a few minutes, so we'll go through the first one. So back on your Jamboard, there's, on the third little slide, there is a change idea. So based on our data, we are going to focus on what we want to improve is we want to provide ongoing support for implementation to improve professional development in trauma-informed practices. Because what we saw were we had some trainings, but there wasn't good follow through and we needed some more support around there. So that's our change that we're hoping for. And what you're going to do is try to come up with little tests of change, little small things that you could change in your day-to-day. And you can think about the school or district that you're with now. What is one little thing that you could do in the next 2 weeks that would be helpful in testing or seeing if it would improve this? So one of the examples is leaving 5 minutes for training implementation questions at the end of a weekly staff meeting, right? That's something that can be implemented at the next staff meeting, that you just add it as an agenda item, asking staff how they're doing with whatever training they were supposed to be implementing. So that's a small test that can be implemented within as soon as the next meeting. Or if you have somebody who's responsible for, or who is going to be responsible for ongoing training, that person might meet with one teacher and provide one strategy from the training that they want the teacher to focus on and schedule a 15-minute follow-up for the next week, right? It's something small, it's something concrete, it's something you can test to see if it works. Yeah. So seeing if stipends work for having them engage in training. Yep, the only thing you'd have to see, do you already have the money to do it? Or would a survey to teachers to ask about whether or not that would be helpful be something? Okay, so I'm gonna wait for those to come in, and we're running out of time, and I wanna make sure I leave you a minute or two to ask questions. So I'll just show you what's on the last page. So you can also think through what would happen if your test didn't work, right? So if you added the 5 minutes at the end of the staff meeting and nobody said anything, then maybe for your next test, you try having staff submit training implementation questions before the meeting and see if that works, right? We're still staying pretty small. Or if your teacher went and did, or your fidelity monitor went and did the meeting, but the second meeting didn't happen because it wasn't in the schedule, then maybe your test of change is making sure you send out calendar invites for both meetings to get it on people's calendars and see if that helps improve your support of teachers' ongoing professional development. That kind of makes sense? Okay. I'm going to stop talking and I'll see if there are any questions that have come in.
Thank you so much, Dr. Reeves. I really appreciate the focus on small victories. It's something for us to keep in calm in thinking about our action agenda, which poses really big strategies and action steps to take, but thinking about how we can make those small and smaller victories along the way. So I appreciate that. We did have one question come in. You demonstrated on the SHAPE system the way to compile data from multiple sources on some of those quality measures. Does the system also allow you to look at trends? So look at change or improvement or regression, at multiple points in time and assess if you're doing better or worse along the way?
So It doesn't compare over time. You do have access to your reports over time. So if you go in, you did last school year, you went in again and you did this school year, both of those reports will exist. And you can download the CSV file to do some more of that more complicated manipulations. But Shape won't track those changes over time, but you will have access to your data to do some of that additional manipulation of it to see whether or not there were changes.
Oh, great. So you can compare side by side on items and on totals, but if you wanted to do some sort of statistical analysis, you could download the data. It sounds like. Okay.
Yep, if you want to do statistical analysis, you'd have to download it.
Okay.
But you can look up your old reports.
We have time for a couple more questions. If anybody has any, please feel free to submit them to the Q&A or in the chat, and we'll monitor that. So Danielle is asking if there's any possible way to crosswalk Shape data with other school district and school level data, such as staff retention, attendance, so like school record files.
So we don't have it in Shape, but part of what the school mental health profile asks is how you are using your data. So if you wanted to, again, do some outside manipulation with that in Excel or SPSS, then you could look at what you put in your school mental health profile with what you have in your school mental health quality assessment. The other thing is we do have school IDs that map onto the NCES data. So if there are larger data sets that you want to merge with, we've done that. The National Center for Education Statistics, you can merge onto there. I'm not sure if there are other kind of large scale federal databases that are attached to school IDs that can let you do that. But the system will have the school ID and the district ID that coincides with the National Center for Education Statistics. So you can merge it with different data sets that might have that data if you have access to it. It just doesn't live in Shape. Because we wanted to, there's no PHI in there. So there's no student level data on Shape so that it can stay open and free and available to everybody. But you do have access. If you have access to other databases that map onto those IDs, then you can easily merge them.
And the last question we have time for is, in the entity account, can you also look at trends for multiple districts in a region? I think we know we can't look at trends, but could you look at across multiple districts in a region at the data?
I believe so. I believe it functions similar to the district and state accounts. That's one of our newer ones. So the hope is that it can allow local education agencies that have a different structure than district state to be able to access multiple schools within their region. I'm trying to think of the word it would be, but yes.
Great. Thank you, Dr. Reese, so much. I think the audience is recognizing how powerful and wonderful this tool is, and the fact that it's publicly available and free is just amazing. So thank you so much for helping us all get into better shape. For those of you who could stick with me for just another minute, I'm going to give you a quick overview about what is next on the agenda for today. After a short 15-minute break that we're about to take, we'll return to a full group for the keynote presentation by Michael Meat from the Center for Rural Health Research at East Tennessee State University. He will provide us with the latest stats on the opioid epidemic in the region, and those findings are really sort of a bellwether of the state of the health of our entire nation. So hope you will definitely join us in about 15 minutes. That will be at 2:45 p.m. Eastern time, and that's 11:45 a.m. for you West Coasters like me. And we'll put, thank you, Hannah, for putting the link in the chat. You can also find that on the agenda on the website. So if you take a little break and get a snack and a glass of water, you can come back to the website and click on the join session button by the keynote. During the 15-minute transition, we encourage you also to take a 5-minute pre-recorded guided meditation session by Victoria Schaefer. You can access that by the link in the chat too, or go to the Mindful Resource tab on the Summit website also. And if at any time you need any of our helps, please be sure to email us at info.relap@sri.com. We're here to help if you're having technical difficulties or just need some questions answered. We've got folks staffing that email around the clock. So thank you all. Thank you, Dr. Reeves, so much for introducing us to the SHAPE system. And I can't wait to go in and play around in that data system. So I hope others are as excited. Thank you, everybody.